Deputy Speaker. This 6-year freeze on Medicare rebates is gradually, sneakily undermining Medicare. Set to continue with a Prime Minister's plan to extend it out to 2020. The government's attitude is characterised by a relentless attacks on our iconic health system. Mr. Speaker, this government came to power with a plan to undermine Medicare. This government's first budget, how could we forget this government's first budget, a budget littered with heartless measures aimed at our nation's most vulnerable people. At the very beginning, it became clear that the government wanted to weaken and privatise Medicare. The measures in that budget were astonishing. There was a $7 sick tax, a tax that would have immediately transferred Medicare from a service helping our sick into a tax on our sick, increased costs for medication on the pharmaceutical benefits scheme, encouraging states and territories to charge a co-payment for GP equivalent visits to hospital emergency services. When they introduced this freeze in 2014 and in 2016, as I said, the Prime Minister himself extended it out to 2020. Now, this ice age, as the member for Ballarat has described it, has had a massive effect on our health system. Out-of-pocket costs are higher than they've ever been. GPs are already forced to increase fees and drop bulk billing. As the AMA President Michael Gannon said, the freeze is hurting now and it should have been dropped a long time ago. To quote him verbatim, "We know there are some GPs that are changing their billing practices, and that commences today, July 1st, he was talking about then. The reality is that there are a lot of GPs who decide they could probably take the hit for a couple of years, but they are saying enough is enough. That was on the 1st of July 2016. Now, as the member for Ballarat says, the trajectory of bulk billing is declining. Access is difficult, more difficult, and cost increasing. This time, the government is going through the back door as a way of destroying Medicare. They want to make people pay more, not by the measures outlined in the zombie bills that are still in the Senate, but by reducing the real earnings of our doctors over time. Going all the way back to Fraser, the LNP has, like the Trump administration, opposed what they think is socialised medicine. Their current tactic is no longer to tack it head-on, but it's to index payments received by our medical professionals from Medicare. In other words, as inflation pushes prices up, doctors receive no increase in the value of their payments and are forced to charge their patients. The government's unfair health policies rejected by millions of people at the last election need to be dropped. The increase in the PBS co-payments, the cuts to diagnostic imaging and pathology, the cuts to Medicare safety nets. The day before the election, the Prime Minister promised that no Australian would pay more than to see his GP under the Medicare freeze. This was a lie. The Australians are already paying more for GPs, and out-of-pocket expenses for health are increasing. The current government is making healthcare less affordable for every Australian, with Medicare freeze already forcing GPs to drop bulk billing, as I've explained, and increase out-of-pocket costs. The Prime Minister, Mr Turnbull, is also cutting the member for Wentworth, cutting $1.3 billion from the pharmaceutical benefits scheme and increasing the co-payment by up to $5, the biggest increase for prescription medicine in a decade. As the member for Richmond valuably added, cuts to bulk billing incentives, the payments which give pathologists and radiologists a specific incentive to bulk bill, will mean bulk billing will fall, co-payments will rise and patients will be forced to pay more for tests and scans or skip them altogether, which is something that really worries me with Australia's tradition of preventative health. Their failure to properly fund our public hospitals has seen elective surgery waiting times blow out under the Prime Minister, the worst we've ever seen since records were started to be kept in 2001. And the $1.4 billion cuts to preventative health and health promotion grants are forcing community organisations to close their doors, including organisations which target HIV prevention in young people and LGBT health in Indigenous communities. Deputy Speaker, millions of voters rejected the Prime Minister's health cuts at the last election. Medicare is a universal health system, as the member for Bass pointed out, as imagined by the great Gough Whitlam. It will only be preserved by the election of a Shorten Labor government, with the member for Ballarat as the Minister for Health.